But we're going to begin this hour with today's Health Watch about a lesser known and harder to detect type of breast cancer. Cases are on the rise, and that's very troubling. In fact, the American Cancer Society says this particular type of cancer doubled between 1975 and 2021. CBS News medical contributor Dr. Celine Gounder is here to sort it out for us. She's also editor-at-large for public health at KFF Health News. Celine, really good to see you. I read it this morning and went, oh no. What is it? What is happening?
So a little anatomy here in terms of breast anatomy. You have lobules, which are what produce milk in the breast, and then you have ducts, which are the tiny tubes that conduct the milk from the lobules to the nipple. So most of the breast cancers develop in the ducts. We call those ductal cancers. Those are the most common type of breast cancer.
That's on the side, right? Is it on the side of your breast?
No. It's the ducts are throughout the breast.
Throughout, okay.
And so those are the most common ones. Those are the ones we've studied the most, that we know the most about diagnosing and treating. Breast cancers in the lobules, so what makes the milk, are called lobular cancers, breast cancers, and those make up about 1 in 10 of breast cancer cases.
Is that in the nipple area?
That's also throughout the breast. So you have the lobules, you have the ducts all throughout the breast.
Okay.
And then the lobules make the milk, that goes through the duct, that gets out the nipple.
All right.
And what we've learned over time is just like you have different kinds of cancer, different kinds of autism, different kinds of long COVID, even within breast cancer, you have many different kinds of breast cancer. And what this study is calling for is more research into this particular type of breast cancer, lobular breast cancer, so we can learn how better to diagnose it and treat it.
So why is this particular type of cancer on the rise?
We don't have all the answers to that. We do know one of the risk factors is hormonal exposure. So lobular cancer is fueled by hormones. So the more hormonal exposure, and that's related to when you have your first period, when you have menopause, how many kids you have, and when. All of that relates to your risk of hormonal exposure and your risk of this particular kind of cancer.
Is it something you can feel? Because I instantly was going like this. Is it something you can feel? You need a mammogram, an ultrasound?
Yeah, this one is a little bit more challenging to feel because of the way it grows in like lines as opposed to lumps.
Lines.
Yeah, so it can be a little bit more difficult to detect both on mammogram as well as on a self-exam.
So bottom line advice for women who are paying attention right now?
Bottom line, okay, first of all, if you notice something different, and this isn't just for your breasts, if you notice something different in your health, talk to a doctor. There might be something going on. Secondly, don't miss those breast mammograms, those screenings for breast cancer. That is really important.
Age?
Starting age 40.
No, but I mean, for this particular cancer, is it more common in certain age groups?
We see it across the board, although younger women can certainly be getting this particular form of breast cancer.
Okay.
All right. Necessary segment. Thank you so much,
Yes,
Dr.
yes.
Gounder. Thank you.